My name is Max Banfield. About 40 years ago, 1975, I had several health problems which weren't responding to treatment. So I decided to study them myself. And since then, many of the concepts which I developed have become widely known all around the world, at least four of them. For example, in 1976, I enrolled in an exercise class at an organisation called the South Australian Institute for Fitness Research and Training, and I developed an exercise method with related concepts and was 7 years later was invited by the head of that organisation to design a program to help other patients, and that was reported in newspapers as well first, and is now used all around the world by other people who call it pacing, and it's used to treat the chronic fatigue syndrome. Between 1975 and 1980, I observed that sometimes leaning forward was associated with some of the symptoms. For example, leaning forward in one instance caused kidney aches, in another instance caused breathlessness, in another instance caused abdominal pain, then it might cause dizziness or faintness. So by 1980, I was able to produce an essay of that nature and have subsequently referred to that as the posture theory, essentially that sitting and leaning forward is the cause of a lot of health problems. Within about 23 years, I also concluded that if sitting is causing problems, then sitting up straight may relieve those problems. Standing might relieve those problems. But initially there wasn't much success with that sort of approach. But as time went by, I added a 6-inch bench to my desk, and then as the years went by, I had another 6-inch bench on top of that, and I started standing at the desk. And then I added an angle platform to the desk, and then learned to use a typewriter, and then started using computers, and ultimately developed the world's first standing computer desk in 1998. At that time, and up until then, I'd used benches. Other people sometimes use benches occasionally, for one reason or other, but there was no coherent, organised reason for doing it, and they were quite rare. But since the development of the standing computer desks, they've been manufactured and sold in their millions. Now, another 16 years went by, and I discovered the cause of a common form of chest pain that has been a mystery for thousands of years, and that the world's best research has been trying to solve for a long time, over 100 years. So today I will discuss how I found the cause of that pain. I will then discuss the value of that discovery in terms of the amount of money it saves governments internationally. So I will start now. When I was 14 years old, I went on a scout camp with some mates, and when we arrived, we set up the tent and we laid thin canvas ground sheets in the tent on rock hard ground. And then we placed our sleeping bags on top of the ground sheets. And then we went hiking, we made a campfire, cooked some tea, and so forth, and late at that night went to bed to sleep. I woke up in the middle of the night, and my left fist was in my left chest, and I was laying face down, and the left side of my head, chest, abdomen, arm and leg were numb. And I said to one of my mates, do you think I should get a doctor and make sure there's nothing serious going on here? And he was only 14 years old himself. He said, nah, just roll over. You'll be right. And so I was in a situation where I basically just had to roll over. And it was very difficult because my left arm and my left leg weren't moving. So I had to awkwardly manoeuvre my right shoulder under my chest and then get into a position where I could then fall onto my back. And I went to sleep. I didn't have a lot of choice because outside it was dark. I didn't know where we were. Couldn't see the lights of the city, and I wouldn't have known how to get back to the city anyway. Well, a few hours later I woke up and everything had returned to normal. There was no numbness, my arms and my legs were working okay. So we continued the activities of hiking and swimming and so forth. And at the end of the weekend we hiked home. Well, about 3 months later, I felt this sharp stabbing pain in the lower left side of my chest. It was as if someone had thrust a 5 centimetre long sewing needle in and out of my chest, like this. And I thought, what was that? And I didn't know. There was no wound, no cut. So there wasn't much point going to a doctor because I didn't know what to say. But a month or so later, I had some other incidental health problem where I went to the doctor. Can't even remember what it was. And at the end of the consultation, I said, by the way, Doc, I had this chest pain about a month ago. And I said, do you know what caused that? And he said, no, I don't. A nice guy, GP. Didn't know. And then I explained what happened at the scout camp. I said, do you think that might have had anything to do with it? He said, no, probably not. And then I said, well, what causes it? So he applied his stethoscope to my chest. There's nothing wrong with your heart. He applied it to my lungs. Nothing wrong with your lungs. I said, well, what causes the pain? He said, I don't know. Well, a few months later, that pain occurred again. And there were still no signs of injury. It just happened for no apparent reason. And so I didn't go to the doctor. A couple of months later, when I went there again for some other reason, I said, by the way, Doc, that pain came back. Do you know why? He said, no. So I said, well, what do I do? He said, oh, I'll send you for a blood test. I'd probably send me for an x-ray. And they came back, there's nothing wrong with the blood, nothing wrong with it. Nothing seen on the x-ray. And so that was that. Well, a few more months went by, same pain occurred for no apparent reason. And in due course, I went to the doctor. And I said, again, this pain has come back, what do I do? And he explained there's nothing wrong with the heart, there's nothing wrong with the lungs, there's nothing in that part of the body that can cause pain, there's no reason for it. And I thought, well, he's a doctor. He probably topped his class at high school, went on to 6 years of medical school. By now he's probably read a few of his reference books, a couple of research journals, and he hasn't been able to find anything. And I thought, I've had a lot of health problems in my life. I had my tonsils out, had my appendix out, had a hernia, so on and so forth, pneumonia a couple of times. And they've been able to cure those. But they don't even know what the cause of this chest pain is. Doctors are only human, they don't know everything, so that's the way I was thinking about it at the time. But there's also the possibility that I've missed something, and practically everyone with this pain at some stage or another starts to think maybe it's their heart. So more time went by, and I probably can't remember it so long ago, but I probably had a CAT scan or whatever, and nothing was found. Well, when I was about 20, I was just casually thinking about various things. I haven't had that chest pain for a while. I wonder why. And I haven't had it since. I told the doctor it hasn't happened for a while. Why? He said he didn't know. Well, as time went by, I started getting aches in my kidneys. whenever I lean towards a desk. And I said to the doctor, can you tell me why that's happening? And he said, no. And he gave me an x-ray and nothing showed. And about a year went by, went back to him, I said, got this ache in my kidneys when I leaned towards the desk. Do you know why? He said, no. They gave me an x-ray and it showed a kidney stone. And then he gave me a medication to reduce the size of that stone or dissolve it. And a couple of months later I passed it. I've had problems on and off with kidney stones coming and going ever since, even kidney stone surgery, but basically the problem was solved at that time. And then as time went by, I'd lean towards the desk and I'd get abdominal pains. And then I'd lean towards the desk and I'd get breathless. And then I'd get dizzy. And whenever I asked the doctor the cause, he said, I don't know. And there's another doctor by that age and he just shrugged his shoulder, I don't know. And I thought, well, some of these problems are getting to be a bit beyond the pale. I'm going to have to study them myself. But the point is, at high school, I was rather an average student. I think only once in my time did I top the class in chemistry. But other than that, I was rather an average student. I did get through high school, qualified for university, got a few scholarships for one reason or another. And I thought, if doctors can't solve this problem, how am I going to do it? But by the time I was 25, I'm going to have to try. So I started. And as I began to study, make observations, I come to these conclusions that leaning forward did have something to do with these problems. And the general idea was leaning forward compresses the chest and the abdomen. And then I thought, well, maybe that's what caused the pains I had as a teenager. So basically I was concluding that leaning forward compresses the chest to cause chest pain, compresses the kidneys to cause kidney pain, compresses the abdomen to cause abdominal pains, compresses the lungs to cause breathlessness, etc. As an idea worth investigating in more detail later. So I called that the posture theory. And I then started changing my posture, trying to sit up straight, stand up and all the rest of it. While I was reading the medical literature, I come from a few books, research papers, and they would occasionally say that the typical patient has a thin and stoop physique. And I thought, well, yeah, that matches my physique and it also matches my ideas on core. And then I come across this particular comment that if they inject the chest in the skin subcutaneously with a pain-killing drug, the pain doesn't go away. But if they inject it deeper, intramuscular injection, the pain goes away. So I thought, well, that's useful information. To me, it meant it's a physical pain, a physical cause, related to physique, and in a very precise location. So why can't they find it? Why can't they find the cause? Well, there's also these ideas that maybe posture, maybe awkward movements cause it. But there's also the idea that it's worry, fear or stress. There's no physical basis for it, so maybe it's psychosomatic. And they were talking about people who were, afraid of sport, worried about life in general. Yet I played a lot of sport when I was young, so that didn't apply. And also saying that maybe the respiratory muscles, when you worry, they tighten up, put strain on the chest wall. I didn't think that was particularly relevant either. But those were the popular theories at the time, and they overshadowed any other comments about posture and physique. So there was this evidence that physique and posture had something to do with it, and that was what I thought was the case. Now, what can I say now? The posture theory. Now, about 10 years went by, and I was diagnosed with cancer. And the specialist said that my body was riddled with it, the neck, kidneys, everywhere. My blood, my bone marrow. He said, you only got 2 months to live. And their way of presenting this information is rather gradual. And he eventually said, tidy up your financial affairs, which means write your will. So I then had to decide, what do I do? And I thought, the chances of curing cancer in 2 months are pretty slim. When I was 25, I had many years ahead of me, and if it took 1 or 2 or 3 years to solve the problem, well, so be it. But if I only got 2 months to live, it's not likely I'm going to cure cancer when all these other experts can't. So I decided to write a book about posture and health, and like a lot of people, I'll leave it to posterity. And I'll sell it to schools and libraries so the next generation of kids will realise how important posture is and sit up straight. So I gathered all the evidence I could about posture and health and put it into a book, sold to libraries, school and public library, mainly. And if I lived, well, maybe I'll make a profit out of it. So as time went by, I developed more and more ideas that were leading to the fact that posture was the cause of a lot of health problems. And then in 1997, I got heart disease. And was told I needed bypass surgery. But I read a book by Nathan Pritikin and treated that with the diet quite successfully. It took a very difficult thing to treat with diet. You have a bypass operation, you've got no problems, and a couple of days later, if everything goes well. It took me well over 6 months to recover with diet. And so one of the issues with the chest pain is the patient goes to the doctor and he sends them to a cardiologist, and the cardiologist needs to decide the difference between chest pain and heart disease. And the general difference is that chest pain is a sharp stabbing pain and the heart pain is in the centre. So when I had heart disease, I didn't know what it is. Just because you read a few books, you get the general idea, but I didn't know what it was. So it was about 3 or 4 months before I consulted a doctor about it. And once he diagnosed that it was angina, it became quite obvious. So I know the difference between these two pains, and they're quite significant. One's a sharp stabbing pain there, and heart pain is generally here because it's a crushing pain, a dull sensation. So in my case, I had the typical chest pain here and the typical crushing pain here. So I had the chest pain and the heart pain. I knew the difference by then, and it was obvious. But the trouble is, that's easy for me to say, but when you're a cardiologist, it's a little bit more difficult because this chest pain can occur in a variety of locations. It just mainly occurs there. And the heart pain can have various symptoms associated with it, but it's generally there. So when the typical cases are quite different. And then I got over that, and it was around about that time when I'm adding and changing bench shapes and sizes that I invented the standing computer desk. I was also having chemotherapy for cancer and surgery for cancer. This operation removed a tumour about that big from my neck. Around about that time, I invented the standing computer desk. And then after that I had more cancer surgery, more chemo, and a stem cell transplant. And ultimately, a couple of years of side effects, and I survived. Now, about 16 years later, I stopped writing the book, by the way, in about 2000, and it reached 1,000 pages by then. And the standing desk was the first illustration and the final conclusion of that book. But about 16 years later, from 1998 to 2014, I had a comment from the internet by a chap who said, "Why don't you write for the British Medical Journal?" And I thought, well, first of all, I'm not a doctor, and I didn't think they'd publish it. I'd sent them items before and they didn't publish. I assumed it was because I was not a doctor. And I was a freelance researcher and I was trying to make a bit of money about this. So I didn't know that it was entirely appropriate. I was going to succeed if I did send them. It was just a waste of time. But I sent them an essay, and in due course I found out they published it. So then I sent them one a week for about 18 months, roughly 1,000 words per essay. And amongst those essays, the first few essays, some of them were about the chest pain. And this chap named L. Sam Lewis said, "Why don't you look up the slipping rib syndrome?" And he was polite about it. That's refreshing, because when I've been writing these series, I've come up with a lot of criticism, and some of it's quite hostile. And this chap, by contrast, just said, politely said, "Why don't you look up the slipping ribs?" And he added a useful link, which was even better. There's a link to a research paper, I think of Rob, whatever. And I got interested in this particular aspect. I thought there's a lot of promise here. I reckon this could be getting close to the answer here. And then I looked at some other research papers. And I come to one by a chap called Muley. And he was in a situation where he's using sonography, ultrasound probe on his patient. And this woman was playing cricket in the morning, and she had a lot of pain in her chest. And it was from overstretching her abdominal muscles, which would have been probably the bowling action. And when she got to hospital, Muley examined her. And he would have asked her to lay on the bed and then apply Valsalva's manoeuvre, from what I recall. Now that's where you hold your nose shut and your mouth shut, and you breathe out under force. And so your cheeks blow out, but so do your lungs. And that stretches your rib cage. And when he asked her to do that, and he's running this sonograph probe over, and I just explain for people who don't know what sonography is, most of you will. When a woman's pregnant, X-rays can damage the fetus, so they use sound waves, and that's called ultrasound. And you can see on a TV screen the baby's arms and legs. Well, when you apply that to the chest, you can see what's happening in the chest, and that's what he did. And when he asked her to do this manoeuvre and basically stretch her chest, she said she was in pain. And then he heard a click. And that's been reported in various research papers in the past. And then he saw on the sonography screen one rib bouncing out and bouncing back. And I thought, that's pretty useful information, because that will explain one reason why doctors couldn't see it. Because when the person has the pain, the rib bounces out and then back to where it started. And it goes out of position and back to the normal position. So you go and see a doctor 2 hours later, and usually he can't feel anything abnormal because it's the same. It's in this normal position. You have an X-ray a week later. Medicine has progressed a lot in many ways in the past 40 years. And but I can remember the time when if you wanted an X-ray, you had to go on a waiting list. It might take you a week or two to have an X-ray, even for serious problems. So by the time you have an X-ray, the ribs bounce back to its normal position. And it's quite unusual, really, for this woman to have still had the pain in the afternoon. and for him to see it. But that's the reason, one reason why it hasn't been detected. It's there, it's real, it's physical, but no one could see it 2 hours later. When I'm looking at this, he's looking at cause, and he says injury can cause this pain, like overstretching the abdomen. The problem is most people don't have an injury. They're just like I was. For no apparent reason you get that pain. I wasn't bowling or doing anything. I wasn't heavy lifting. These pains would just happen. But in some cases, there's an injury. So I kept reading about this, a few other research papers, and it appears though like some people, 2 years or 5 years or 7 years earlier, had an accident of some sort. And then they may or may not have had pain, but they get this other pain every few months since. And so that's consistent with my experience on the scout camp and then getting these pains after. And so, and there's suggestions that it's postural factors and awkward movements can be involved. But nobody studied it or did anything about it. Nobody looked into it. So I'm sitting there thinking, well, but that's probably the cause. I mean, the major cause, not injury, because injuries are rare. Because most patients who go to the doctor with this chest pain, the doctor says, what did you do? I don't know. And your patient says, what's the cause? And the doctor says, he doesn't know. So nobody knew, right? So in most cases, there isn't an injury. And so this is more and more evidence that posture is the cause of it. What I've been thinking all along. And so I come across another research paper, or one of the ones I was reading, and there's a report in one of them that the anterior rib tips curl up under the ribs above them. And while I was trying to work out exactly what they were talking about, trying to translate the wordy description into an anatomical view, I thought, this glass is going to be here somewhere. But what are they talking about? And because this is becoming, it has always been a puzzle, but this is some more puzzling information. If you put too much time into this, it's counterproductive because you just end up confused. So what I take is usually take a break for a while. I'll come back to this next week and I'll work on this again. And so I took a break and I had lunch, but in the afternoon, curiosity got the better of me. So I thought, what is he talking about? These rib tips curling up under the ones above. And then I thought, well, there's something really mysterious here. Because I must have had 50 x-rays in my life. And they've never ever said there's anything abnormal about my ribs. Never. Not to my description. Doctors never said so. I've never noticed on any x-ray report. How could that be? Because when I was young, appendix out, tonsils out. You get pneumonia, they do an x-ray. You have a shoulder injury, they do an x-ray. You have kidney stones, they do an x-ray. And when you get cancer, they monitor it. They give you a CAT scan every 3 months. And I had cancer for 6 years. That's 24 CAT scans. That's minimum. When they really want to know something, they give you another one. And they give you x-rays in between, a number of other tests. And then after you've recovered from cancer, they keep giving you x-rays every 6 months or every year to make sure it doesn't come back. So I must have had 50 x-rays and CAT scans. And I've never, ever said anything about my ribs. Never. I thought, how can that be? This guy is saying the chest pain is due to ribs curling up under those above. And with a little bit more thought put into this, what is happening is your ribs are, you've got 12 on each side, the top 7 are attached to your sternum, the next 3 are attached to each other and the next 2 are floating ribs. So it's the 3 that are attached together that are curling up. And I thought, how can that be? And while I'm trying to work that out, I thought, I know what I'll do. I'll run my hand down my chest. So I ran my hand down my chest. And the 8th rib sticking forward by 1 centimetre. And I'd solved a 3,000 year mystery. Been puzzling people for over 100 years. I've solved it. Because all the pieces come together. When I found that rib displaced, I knew what was going on. So this is what it is. Takes a while to explain, but I knew instantly what the problem was. And so I'll give you a couple of explanations on causes. One of the research papers talked about a person getting kicked in the chest. And I thought that pushes some ribs back and leaves one rib forward. And it stretches the attachments and makes that rib loose. So they have an accident 6 years ago, and the rib becomes loose, and they may or may not have pain at the time, but 3 months later that loose rib slips when they scratch their head. It's loose. Just being loose doesn't cause pain. But when you scratch your head and stretch this musculature, it's attached to that rib, you're dragging on that rib, and it slips over the other rib and pinches a nerve underneath. So this is what I was thinking. Supposing you're in a car accident and you hit the steering wheel, it pushes some ribs back but not the other, and it stretches. You might not have any pain after the car accident, a bit of a bruise, who cares? But when your rib is loose, that's not painful, but a couple of months later you get pain. Right? So when I was on the scout camp when at the age of 14 and my fist was in my chest, it's quite likely that it was pushing some ribs back and not the ones next to it. And so the attachments were becoming stretched, and therefore that underneath rib was becoming loose. And so whilst I had some problems at the time when my fist was in my chest, when I woke up the next morning and all the symptoms were gone, nevertheless the rib was loose, and 3 months later I scratched my head. I don't remember scratching my head, I don't remember turning the newspaper, but it's something like that would have made that loose rib slip. So that's one thing. Now what about physique? How would that cause this? And this is what I knew. Some people are like Pavarotti and they've got a deep chest. They're not going to get this type of problem. Highly unlikely. But I had a vertical chest and a stooped spine. Now when I was young I used to walk around like this because it felt natural to me. Because I'd had a lot of illnesses when I was young, right? So, I have a vertical chest. Now, because I worked on these things and had realised that posture has caused a lot of problems, I started walking upright, okay? So I now walk upright. But for me, if I didn't know anything about posture, I'd be walking like this because it's comfortable. And that's a paradox. It's actually a cause of problems. But this is what happens. The top 7 ribs are pushing down on the 8th rib. And the 8th rib is following the abdominal curve. And most people have a bit of a belly. And as you lean forward, you're pushing down behind that 8th rib and gradually pushing it forward. And what happens then is it becomes loose. So that's the mechanism for it. And so because of your physique, you ultimately are likely to get a loose rib, and any other incident or accident is making it more likely. And then you're just walking around with a loose rib, you don't know why, you don't even know it's loose, and so forth. And you do something instantly. That's the solution to the problem. So now, anyone goes to a doctor, says, "Doctor, I've got chest pain, it feels like a stab." Doctor says, you got a loose rib. Don't worry. Go home. 5 minutes. Problem solved. There's none of this going for an x-ray, CAT scan, cardiac, blood test. No mystery. The patient isn't scratching his head. The doctor isn't confused. He knows instantly. So I've saved governments and healthcare organisations billions of dollars, massive amounts of money, because all those testing aren't necessary anymore. And that's what I'll discuss now. In the past, when a person went to the doctor with his chest pain, just the same as I used to, have a GP appointment. You pay the GP or the government or the health insurance company. You have a physical inspection, you use your stethoscope, thermometer to check for fevers, blood pressure. Oh. That doesn't show anything. Blood test, x-ray and a CAT scan doesn't show anything. No. There are various reasons why this rib abnormality doesn't show. I may go to that later, but for now I just explain this to you. You go to a heart specialist. He does a cardiograph, that's normal. It doesn't show anything. Then you go to a gastroenterologist, because it may be referred pain from the stomach or the esophagus. It shows nothing. And then you go for surgery and you have a laparotomy. And the surgeon opens you up and he has a look in and he can't see anything. That costs money. Then you have people, and this is quite common, they get this chest pain and they think it's their heart, because a lot of people associate chest pain with their heart, and they go to hospital and pay for an ambulance. And then if you worry about your heart, you might see a psychiatrist 3 times a week. That costs money. And they might be able to reassure you, but it's hard to believe that there's nothing wrong with your heart if the doctor doesn't know what the cause is. And so a lot of people do worry about it. And the psychiatry won't fix it because it's due to your physique. Now, the chest pain. There's research into the cause. In the years, it amounts to billions of dollars spent on research. It's a 3,000-year-old mystery. For at least 150 years, I've been putting a lot of time into trying to solve this problem. And all that research couldn't find the cause. They have teams of people. There's 10 million doctors and maybe 1 million specialists, and they couldn't find it. And then they're using multi-million-dollar microscopes, CAT scans, MRIs. They didn't show it. Surgical anatomy studies, autopsy studies, and tens of thousands of books, research papers, and projects, and they didn't know the cause. The statistics on the cost affects 5% of the population. There's 7 billion people in the world, and 5% is 350 million. And the average cost of the patients of all this, I worked out, in a 5-year period, and anyone can check the cost, would be about $5,000. In other words, $1,000 a year. 350 million times patients times $1,000, which is $350 billion a year. Now, after my discovery, the 350 million go to their GP and says, "Oh, you've got your posture is causing a rib to be $1 billion. I've saved taxpayers, healthcare funds, health insurance companies, etc., $349 billion a year, every year for the next 5,000 years. So that's a summary of the cause and the benefits of discovering the cause of that chest pain. And I may discuss a few other matters at a later stage. But thank you for watching.